Now at this MAHA event in Washington about eliminating sugary foods and drinks in many states from the SNAP program, the food stamp program. Let's listen.
In a chronic disease crisis. Her changes to the SNAP program are emblematic of that commitment. SNAP, we're spending $405 million a day on SNAP. And about 10% is going to sugary drinks. And and if you add candies to that, it's about 13 to 17%. And we all believe in free choice. We live in a democracy. People can make their own choice about what they're going to buy and what they're not going to buy. If you want to buy a sugary soda, you ought to be able to do that. But the U.S. taxpayer should not pay for it. And the U.S. taxpayer should not be paying to feed kids foods, the poorest kids in our country, with foods that are going to give them diabetes. And then my agency ends up through Medicaid and Medicare paying for those injuries. So we're going to put an end to that, and we're doing it step by step, state by state. I'm also working with Secretary Rollins on the dietary guidelines, which should come out next month. They're coming out, I think it's the end of September, 3 months ahead of schedule. And the dietary guidelines that we inherited from the Biden administration were 453 pages long. They were driven by the same commercial impulses that put Fruit Loops at the top of the food pyramid. And they were incomprehensible. And we are going to release dietary guidelines that are 4, 5, or 6 pages long, that are understandable, that are simple, and will allow people to make good choices about their food. They will drive changes in the school lunch program and prison lunches and military food, and they will begin to change America almost immediately. We're also working on the release of the MAHA report. Brooke especially has been adamant about the issue that we need to keep farmers as partners in the MAHA movement if we're going to have nutrient-dense food. And that is what we care about. And we've had over 130 meetings with farmers to understand their concerns, to learn from them, and to understand how we can help them transition towards more and more nutrient-dense food. I also want to thank President Trump for the big, beautiful bill. If we're going to save the American farmers, we need to save rural America. Right now, Medicaid gives about 7% of its funds to rural hospitals. 7%. It's about $20 million a year, $20 billion a year. We are now going to add through the Rural Transformation Bill, we're going to add another $50 billion over 5 years. So $10 billion a year that's going to be distributed to the states, to rural areas, and that is going to add about 1/3 of the money that they now receive from Medicaid, and it will transform them, and it will allow these institutions, which are so critical to the economies, to the culture, to the health of rural life, it will allow them to flourish. And the president understands the American farmer. He did more during his first term to save American farmers than any other president. And we are going to continue that tradition. So thank you very much for your leadership, Secretary Rollins.